Lovely to
Hello.
see you.
You too. You too.
You ready to go?
I am.
I'll hand over to you. Good luck. See you in 5 minutes.
Thank you very much. Thank you. Good evening, everybody. My name is Tina Ellen Lee, and I'm the Artistic Director of Opera Circus and co-founder of this artist-led performing arts organisation, which for over 30 years has developed new works of opera and music theatre in the UK and globally. We act as a catalyst, enabler, changemaker, networker, fundraiser, producer and provider of multiple opportunities for thousands of diverse and disadvantaged young people through music and the creative arts in the UK and wider Europe. We are the producer of the new opera Nachiketa at the Queen Elizabeth Hall, South Bank, London, with the chance to scientifically experiment with live music and the new technology X System. Mental health concerns have reached pandemic proportions, and this is our contribution to this incredibly important research, with a view to eventually providing a simple, effective response through music in the UK and on a global scale. A study of NHS staff working in critical care during the pandemic showed more than twice the rate of probable post-traumatic stress disorder than that found in military veterans with recent experience of combat. Mental health problems quadrupled in NHS staff during the first wave of COVID-19, according to the largest survey carried out into the psychological effect of the pandemic on UK health workers. Demand for mental health support for children and young people across all services has already grown significantly since the pandemic, with the number of children and young people contacting mental health services rising by nearly a third in the last year. The global economy loses more than $1 trillion per year due to depression and anxiety. Mental health conditions contribute to 25% of years lived with disability in the world. Growing scientific evidence in the area of arts and mental health suggests that music is one of the most useful tools available that may play a vital role in helping to deal with mental health. X System, co-invented by Nigel Osborne, composer of our opera, Nachiketa, analyses music to predict its effect on health and well-being and how it may help change your mood and feelings. X System uses a model of the musical brain to predict the level of relaxation or excitement of a piece of music and how positive or negative a mood of emotion it may make you feel. It's currently being trialled in the effective treatment of both epilepsy and severe psychosis, as well as with dementia, in-surgery support and prenatal care. The performance of Nachiketa offers the opportunity to test X System through the audience's and artists' emotional responses to the music. This will be the first time we can gauge music's impact in a non-clinical setting, providing the potential to prevent and alleviate mental illness in the community without medical interventions. Our current partners include the NHS Recovery Colleges in Tyne and Wear, with interest from the Central and North West London NHS Foundation Trust with over 7,000 staff. For nearly a year, we've supported training for primary school teachers through Dorset Council's Music Hub, and we're now engaging with the NHS Dorset Clinical Commissioning Group. South Bank's Creative Learning Department has requested training for their team, and we're talking with Warwick University about a series of pilot interventions in India. James Sanderson, Director of NHS Improvement and CEO of the National Academy for Social Prescribing, has said, "An X System music service could represent a bridge between experience and tailored interventions, enabling the well-being benefit of music to be experienced at scale." Dr. Angela Kennedy of Trauma Care England and our partner in the Nachiketa project has written the following to us. The Nachiketa Opera Project will form a central part of the next phase of this collaboration, which will include musical trauma-informed care interventions based in schools in selected regions, building cross-service provision for children combining education, health and social care in the UK. The planned Nachiketa-linked interventions in India and Somalia will be of particular interest to the NHS. Just as it will take a coordinated world effort to roll back the pandemic, it'll also require the use of cross-cultural tools to roll back the many challenges to mental health internationally. The project we're asking you to support has the potential to deliver change at scale. This feedback from the music teacher at a Dorset primary school. By drip feeding our training with music and X System into our normal school days, the children were better able to regulate their emotions, which had been heightened by the pandemic. One child who'd experienced hardships throughout the year really connected with the practice and often requested it, saying how much he enjoyed changing his feelings. The class grew calmer as a whole and better understood their emotional states and the power they had to regulate and change them through music. With mental health issues developing on an unprecedented scale, both in the UK and globally, we need to try new creative solutions that can be delivered at scale. Opera Circus, our role is crucial in testing this innovative approach. We're excited about its potential to improve mental health care in the UK and eventually globally, and invite you to join us as we explore this highly scalable, low-cost intervention which is already being successfully used by the NHS and piloted in primary schools. The money we raise tonight will go towards the total cost of the live scientific experiment during the performance and the analysis of the research data, which is £18,000. For your information, we've added to this slide the other costs involved with the Nachiketa project. Thank you to our sponsor, Edna Kissman, and the Funding Network for this opportunity. I would just like to play you just a short extract from the opera, Nachiketa. Thank you.